Hiya, welcome back to my channel. There Will Be Blood, a bit of an unnecessary graphic title, I'm sure you'll agree, but it's part of being diabetic, so it's something I want to go into. I want to tell you a little bit about what I've learnt in the short time I've been sort of doing something about it. I'm going to show you how I test myself. That bit will be possibly a bit too graphic for some of you, but it's tiny little drop of blood, but if that's too much for you, you can always skip through. I'll pre-warn you, and you can also skip past it in the timestamp, so you find that down in the description. Before I get into all this, I just want to welcome you back to my channel. Thanks so much for coming. If you subscribed, that's absolutely fantastic. Thank you so much for supporting me, and if you hadn't, please do consider doing that, and don't forget to hit that notification bell so you get an update notification when I put a new video up, so that'd be fantastic. Anyway, let's get to the subject in hand. So, big question, what is diabetes? I should say before I actually start into this is that I'm not medically trained. What I'm doing, I will do under medical advice, and if you're thinking about changing things, etc., then speak to your health professional. I think that's very important, so do that. Right, so diabetes is essentially a resistance to insulin, and type 2 diabetes is essentially a resistance to insulin. Now, insulin is a hormone created in your pancreas, and it sort of allows your glucose molecules on your blood to be absorbed into the cells and utilised. So when you don't have that option, where it's very difficult for the sugar to be utilised, it stays in your blood, and that's when it causes problems with diabetes. It's also related to the liver, because of course the liver moves sugars into the blood as well. So it's a lot more complicated than that, but hence simplistically. Why people that are overweight are more predisposed to developing type 2 diabetes. There's various theories, but I don't think anybody knows for sure. There's some think that it could be to do with fatty acids which build up in the blood, but I'm learning all this myself at the moment, so I'm just going to keep it simple. Just like me. Having sort of my story with diabetes is a little bit one that I wouldn't recommend anybody following, and I feel a bit bad about it because potentially I could have prevented it. I was told when I was pre-diabetic, so on the verge of becoming diabetic, and then I was told when I was diabetic, and I ignored it then as well. I buried my head in the sand. It was just another thing for me to have to deal with, and I didn't want to have to deal with it until I started getting sick, which I still am. Just like every day I feel very unwell and dry mouth and etc., which is why I sort of went back to the doctor, and they said that's symptoms of diabetes, and they put me on a drug called metformin, which is quite a common drug, and apparently it's a very good drug. It's very effective. It doesn't sort of particularly lower your blood sugar as such, it just helps the liver handle the glucose better, is my understanding. So but at the moment I'm on 1500 milligrams of it, and I'll move up to the maximum dose of 2000 I think later next week. I couldn't tell you if it's, I think it might be working, because I think my daily sugar readings are slightly lower than I'd expect. They're not low enough at the moment. I'm struggling to manage that, but that's something that's going to come with time and experience, and as of recording I've been getting very little guidance from health professionals, so I hope to rectify that soon. So I'm going to kind of talk to you a little bit about how I test my blood sugar, and then I'm going to show you. So I use a thing called a glucometer, and it tells me, I put a drop of blood on it, and it tells me what my blood sugar is at that moment in time, which is really useful for managing what you eat, so you know which foods. Everybody's different, so some foods will react and some foods won't with other people, and vice versa. So I, for instance, know that cornflakes is not a good thing for me to eat because it really spikes my sugar levels. So it's a learning process for me. People with type 2 diabetes generally won't be given a glucometer. They'll just be maybe given medication or told to eat more healthily, and then it'll be sort of assessed maybe every 3 months initially, because you get a I can't remember the name of it, but I will put it up there. You get a reading which is an average over the lifespan of your blood cells, which is 3 months. Having sort of realised that I had to do something about this, I sort of got some advice from a group online, on a Facebook group, which I put a link to down, which have been fantastic, which is, I think they're called Diabetes UK or Diabetes Type 2 UK or something like that, but I'll link to it in the description. And they sort of, quite a few people advised me to get myself a glucometer, which is, I just bought it. I did a bit of research into which are the better ones, and I got this one from Amazon, and I'm not sponsored by the way, obviously, and I've been using that for the last couple of weeks. So I tend to use it in the morning before breakfast, because that gives me my fasting levels, and then I use it 2 hours after breakfast, because that's the prime time, 2 hours after a meal. I skip the lunch one, and then I do the evening, so just before my evening meal and 2 hours after it, and it gives me sort of a general idea of what's going on. I skip the lunch one just because I don't want to have to prick my finger 6 times a day at the moment. At the moment that's sufficient for me to get a hold on what I'm doing and if what I'm doing is right. I think the reason that the NHS won't give you, or generally won't give you one on prescription, is because, you know, there's a lot of diabetics type 2, and some studies say it's not necessary, some say it is, but it's really only absolutely necessary if you're using insulin, because obviously you need to know what your levels are to know how much insulin to use. So but I'm certainly not at that stage yet, and I hope I never am. So I told you I'd warn you, so I'm about to show you the monitor and how I use it and what it tells me. So we'll head into the kitchen. So the blood glucose levels check and how I do it, etc. Welcome to my rather untidy kitchen that hopefully you can't see too much of, but I'm going to show you the tools for the job, and then I will hopefully show you me actually testing my blood. There won't be a lot of blood, don't worry, but there will be blood, like I said in the title. So here we go, hang on. So this here is the glucometer. I'll show you again in a minute when I put the strip in, but I just wanted to show you it's a digital display as you'd expect, and it'll just give me a reading basically. Now this here is the business end. This is what I pierce my skin with. So I'll just show you. I unscrew here, and then just bear with. This here is a single-use needle which I put in here. Twist the top. By the way, I keep these tops because I put it back on the needle when I dispose of it in a sharps bin, which is quite important. So I don't know what the focus is like here, but probably not that good actually. But anyway, you get the idea. It's a sharp little tiny needle, nothing at all to worry about. So once that's in there, I put this back on, and that's it really. Although there's a dial here which goes from, let me see, you dial it from the top, goes from 1 all the way up to 9, and that's your, depending on how thick your skin is really. I must not have very thick skin because I only put it on a 4. I started on a 2 and built up until I had an effective stabbing. So I'll put it back to 4. And I'll just put this down for a second and show you the strips. Now what I will say at this point, they are single-use needles and they should always only be used once. One thing we have to be aware of when we are type 2 diabetic is that we can't afford to get infections and things like that. We're more prone to serious complications, and you could end, if you're reusing needles, you could end up getting an infection, quite a bad infection, and needing your hand amputated. I mean, that sounds extreme, but that's a real reality. So they're single-use needles for a reason. Plus, they blunt very quickly, and that means it's going to hurt when you reuse it. So anyway, that said, let's get this strip. Again, these are single use as well, of course, because you don't want them contaminated. They'll give you a false reading. So there's sort of like a barcode type sort of looking thing on one end, and that's the end that goes into the machine. So here we go. Then that switches the machine on, and that'll stay on for 3 minutes. Now, when I first started doing this, which wasn't that long ago, it took me ages to pluck up the courage to actually press the button to sort of prick my finger. And the reason for that is I'm terrified of needles. I know I've got lots of tattoos, but that's different. And I'm used to blood tests now because I had so many because of the lithium that I'm on. I have to have regular blood work done. But when you're doing it yourself, it's different, and you know it doesn't hurt because even though after I'd done it and it didn't hurt, I was like, my brain didn't want me to do it because it's not a natural thing to do. But you do get used to it, and now I'm okay with it. I have washed my hands, but what I always tend to do, even though I've washed my hands, but I'm handling stuff as well, getting it all prepared. So I use some alcohol-based hand wash, which I'm using now, and this helps as well because you need to warm your hands up a bit so that there's blood near the surface, basically. So hopefully you're not squeamish. If you are, that bit's coming now, and I'll try and do it up here. Now it's better to sort of aim for the edge of your finger if you get my drift, because there's less nerve endings there anyway. So I'll just squeeze. I hate this bit even now. There, no pain whatsoever. Wipe the first bit of blood off, that's what they say. So just massage the blood out so there's enough to, I don't know if you can see that, you don't want to see that anyway. So there's enough to sample, you don't need maybe that much. And then hopefully you can see this. There, then it gives you a 5-second countdown whilst it, and we are, oh that's quite high actually, at 17.9. Now this is taken 2 hours after a meal, and it was a fairly low carb and certainly low sugar meal. So I don't know what's going on, I'm struggling to control my blood sugar at the moment, so that's just the way it is, managing diabetes. So ideally, after a meal, if you've got diabetes type 2, it should be 8.5 or below, so that's considerably higher. But my before meal was quite high, it was around 11, so I kind of expect it to be high, maybe not quite that high, but that's as simple as that. And then I use an app called My Sugar, and it's SUGYR, I think. That's how they spell sugar, and it's brilliant because you can input a lot more information besides what your blood sugar number. It's just useful to have a log, and you can then generate reports which you can give to your GP, etc. So it's a good way, just because obviously it's no point doing this if you're not going to keep a record of what your blood sugar is during different times of day. So it's fairly straightforward anyway, so hopefully that's I will link down in the description for the app for both iOS and Android. I use Android, but I may do a little sort of walkthrough of the app at a later date. If that's the sort of thing you think would be useful, then do mention that in the comments down below. That'd be fantastic. So one thing I did want to mention was the link between diabetes type 2 and being overweight. And you know, there's definitely a link. There's, you know, the majority of people with type 2 diabetes are overweight. Not everybody, I hasten to add, but a lot of people are. And I sort of touched on this earlier, and I did sort of chat about the possible reasons why being overweight causes type 2 diabetes. But what I touch on now is the sort of social aspect of it, and I mentioned in a previous video that, you know, being overweight, it seems to be one of the things that it's still socially acceptable to make fun of. And you also hear people saying, oh, well, you know, everybody's got 30 minutes to exercise a day, and, you know, oh, they just eat too much, and all that sort of stuff. And, you know, while that might be true in some circumstances, it's not true in all circumstances. And being obese or morbidly obese like I am is an illness in itself, and there's varying reasons. I can only speak from my personal experience, but people's metabolism, their genetics, certainly people that have mental problems with their mental health, like myself, that definitely impacts. And not only because, I mean, from my point of view, or my experience, I tend to overeat when I'm going through a depressed period, and you know, that's like a bad coping mechanism, but, you know, and it doesn't really help, but I can't stop it when I'm in that position. You know, it's the sort of horrible, one of the many horrible things about having bipolar disorder. Now, also the medication. I will probably do a separate video about how bipolar has affected me and how the medication has affected me and what medications I'm taking now. I mean, this video would be far too long to include that. But what I will say is I was tried on a lot of different medications before I got to lithium. And certainly a few of those medications caused change in metabolism and also caused me to gain weight by various methods. And I actually gained probably about 6 stone all in, which is huge, obviously. So, you know, people shouldn't be so hard on people that are overweight. You know, a lot of the time they're trying their best to lose it. I mean, I've tried everything to lose weight and nothing's working, and I just don't know what to do, which is something that maybe I'll discuss in a later date. But yes, there's a link between diabetes type 2 and weight gain, but I won't be shamed by people that have no understanding of it. And, you know, the government's almost put this sort of stigma on it as well by saying, you know, this is a big drain on the NHS and etc. And yes, I know it is, but you can't blame every single person that's overweight for that. You know, there's other things, and there's also social things. I mean, you only have to go shopping in a supermarket to know that all the foods that are good for you tend to be very expensive, or expensive at least, and all the foods that are not so good for you are cheap. You know, all the processed stuff is cheap. So people on a budget, you know, what are you going to opt for? You want to eat, you've got to eat, so you can eat within the means that you can afford. So, you know, there's a lot. All I'm trying to say, I'm not making excuses, but I'm just saying there's a lot of variables out there. And before people make judgment on people for being overweight, they should really educate themselves on those things. So, anyway, I'm off my soapbox now, and anyway, I hope that's sort of going through the blood testing sort of procedure and all that. I hope that sort of was of interest to you, and maybe you learned something from it. That's great. So, well, that wasn't too bad, was it? Wasn't that much blood? As I said, you know, it took me a while to get used to doing it and get rid of that fear, but it's almost gone now. I can't just press the button like that, I have to squeeze it. I know, crazy, but that's the way it is. So that's a sort of introduction to diabetes and what it is, and now I'm going to take you on when I'm on my way, give you a little bit of information about what I'm doing. I've got an appointment for a eye screening because one of the side effects of diabetes type 2, no, not one of the side effects, but one of the things it can cause if undetected is problems with the eye and actual blindness. I certainly don't want that, so I'm going for an eye screening where they will be putting some drops into my eyes, which will dilate my pupils, and then they'll look at general eye examination, and they'll photograph the back of my eye and check all the blood vessels, and hopefully everything's okay. I don't know if they're going to tell me anything afterwards, but what I'll do is I'll check back in with you once I'm out of the hospital and let you know how it went, what the experience was like, and then if they've given me any sort of results or information, I will let you know that. If they haven't, I'll wait till I get results and I will report back with you guys, of course. So we'll see you in a bit. So that's me just come out of my eye screening, and it was fairly straightforward. You go in, they ask you a few questions, and then they give you a bit of an eye test in each eye, and then they put the drops in your eyes to dilate your pupils. The drops aren't too bad. They sting a little bit, sort of mild sting really for me, for about a second or two, and then it's not too bad. And you wait around for 20 minutes for your pupils to dilate, and then they call you back in and they photograph your retinas, I think. And that was relatively straightforward, except for me, I've got kind of eyes that don't really want to open, so I had to get a nurse in to keep my eyes open. So a bit embarrassing, but there we go. So of course I don't know anything, the results. They said it'll be about 4 to 6 weeks and I'll get a letter with the results, so I'll report back with you then, of course, let you know how that went. So what my eyes like now, they're okay. Luckily it's sort of an overcast rainy day, so there's no bright sun, and so no sort of ill effect from that, but they are a bit blurry. In fact, I'm not even sure this is in focus, so you'll have to bear with me if it's not. But anyway, so that's the end of the video. I hope it's been interesting for you. Any questions, of course, down in the comments, and I will see you in the next one. Bye.